Hello everybody, how are you? Today is March 8th. It's a warm early spring day in New York here. And today is also International Women's Day. The gift I want to send to myself is going to Manhattan LASIK Center to have the eyes operation and regain my eyesight. You know, I've been wearing glasses and also contact for over 30 years. Can you imagine that? 30 years. I finally decided to overcome my fear and nervousness going to have an operation on my eyes. I'm so excited today, a little bit nervous as well, but I look forward to it. I know this is the right decision for myself. But more importantly, I will interview my Dr. Niksarli. How he is doing what he loves for over 20 years almost, and also saved over 70,000 people and give them the normal sight. So that makes me so excited as well. So I'm so appreciative for this opportunity to resume my eyesight and also get a chance to interview Dr. Niksarli about his passion work. So stay with me on this adventure. Thank you. Here I am. Ten. 110 East 55th Street. This is such a beautiful day, and this is the second day after my LASIK operation on my eyes, and today I can directly wear sunglasses without glasses or contact. I'm so excited, and I have the confidence the operation was so successful, and today I feel so good. So I will visit Manhattan LASIK Center again. Today I will get a chance to interview Dr. Niksarli. So we will see how he's doing what he loves to do and what kind of insights he can share with you. Follow me.
Yeah, the speed limit is 50. Everybody's going 80, 90.
This is like that too, right?
You're going so fast. You go in the traffic, you go 80 miles.
I noticed that.
So much faster than people driving in New York. So I'm just going with traffic.
I noticed it myself.
This is Dr. Niksarli.
Hello.
Let's start our interview. Wonderful. Thank you so much. It's my honor to interview you.
You see much better today.
Yeah, so excited. Thank you for your operation.
You're welcome.
I feel so much freedom
Glad to
here.
help you.
Yeah.
Glad to help
Remember yesterday during the operation, you know,
Yes.
you were keep taking toning like how say you are doing very
Yes.
well
Keep you
and it's
comfortable.
beautiful. Yeah, you make me very
We have to
relaxed.
talk, yes.
Yeah.
When you're relaxed, I'm relaxed.
Yeah,
Makes
and
my job easier.
And he asked me what's my feeling during the operation. I told you it's a magical.
Good. I'm glad.
And today I'm so happy, and thank you for so much for taking the interview.
You're welcome.
So are you really doing what you love to do?
I think so. It's a lot of fun getting patients like you next day so happy from a nervous situation the day before.
Yeah.
They come in and they decide to have it done, and then we give them some Valium to keep them comfortable, and then go to the procedure. They go home,
Yeah.
and then when they wake up next day, it's a new world for them. So
Yeah.
they see them like this tremendous sensation for us.
Yeah. So this is the best part you enjoy from your
Yeah.
work?
Seeing the next day patient is the better part. Obviously, surgery is fun, but it's the same thing over the years. It's boring for us, which is a good thing for
Yeah.
the patient. But seeing the patients transform next day and their happiness.
Yeah.
I even come in on Saturday mornings to see those patients for one-day post-ups.
Wow,
And
wonderful.
I like my Saturdays because it's a lot of post-ups from Friday, everybody happy,
Mm-hmm.
and we just go over their vision and examine them, and that's my Saturdays.
Yeah.
Half day at least.
Yeah, that's wonderful.
Yeah.
So, Dr. Niksarli, I'm wondering, you've been running this, you're the founder of this Manhattan LASIK Center, right?
Yes,
Been
yes.
running for over 15 years?
About almost 20 years now.
Yeah, it's very well known.
Yes.
I get a
thank you.
referral from my aunt. She did this over 10 years ago.
Most of our patients come to their friends' referral at this point.
Yeah, I should have done this many, many years
And that's
ago.
why I hear every single day. But it's never too late.
Yeah. So one curiosity I want to explore is like I learned your background. You
Yes.
learned computer science and
Yes.
engineering, right?
Yes,
In
yes,
Columbia
yes,
University,
yes, yes.
and then also at the same time started medical.
People always ask me, how come you
Yeah.
decided first engineering or
Yes.
computers and now you're doing medicine? But
Yeah.
the thing to remind is that first of all, you have to pick an undergrad degree. So you can
Yeah.
pick history, you can pick art
Yes.
or literature or write poems and
Yeah.
poetry. But what we do is at the fringes of medicine here. This is all high-tech medicine.
Yeah.
We're dealing with very micro molecules,
Hmm.
microns of accuracy. Each pulse of the laser removes quarter microns of tissue.
Yeah.
So we calibrate the lasers, we have to program the lasers,
Hmm.
the microscope, the computer, the laser, everything is combined in one machine. So it's a very, very high-tech environment.
Yeah.
It actually helps me with my engineering background
Yes.
to be doing what I'm doing because I'm great with numbers.
Yeah.
I like dealing with numbers.
Yes.
And all day what I do is numbers. We examine
You
patients
could
and-
also be a accountant for numbers.
Probably,
Why this one?
Yes. So we get their prescription, we then calibrate the machine, and then we program the machine, and then we put the nomograms. It's all numbers for us.
So the
So it's a
ophthalm.
perfect marriage between those medicine and the computer background.
Yeah.
It just fits me perfect. I'm glad that I've done it.
Yeah, but where did you get that passion in like medical initially?
Then I always said it since high school.
Oh,
Yeah, always since high school I wanted to be doing medicine, but as far as doing laser surgery, it wasn't there at that point yet.
yeah.
So I decided ophthalmology when I was in medical school because
Yeah.
it was the most high-tech that I've encountered of all the specialties.
Yeah.
And it just happened by luck that when I was finishing my ophthalmology training last year, this laser got approved, and this
Yeah.
made the ophthalmology even higher tech than it was. So
Yeah.
it became even more accurate, more advanced specialty. So in medicine, what we do is probably is the most minute, microscopic, and accurate surgery. So brain surgery, next to what we do here, is a very macro
Yeah.
and very rough, very kind of an approximate surgery.
Yes.
than what we do. In brain surgery, we deal with millimeters if you're lucky.
Yeah.
We deal with microns all day long. So
Was-
it's the most accurate procedure on the human body.
Wow. I see this ophthalmology is the perfect combination of like science, like technical science,
Yes.
and also like medical passions,
Absolutely.
right?
Absolutely. It's the higher edge of medicine.
Yeah, you're definitely in your biggest
I'm in the right
passion,
place.
right? Yeah,
Yes.
you're right place. Wonderful. So, do you ever have any like a big challenge during this journey pursuing your passion?
You mean during my training?
Yeah, I know you went to all the
Yeah.
best Ivy
Every day was a
universities,
challenge if you
right?
Look at it that way. So going
Yeah.
through all the courses and all the requirements, obviously the training and
Yeah.
the years of planning and getting started with the practice. So a lot of challenges along the way.
Yeah.
But seeing this wonderful technology and what it can do for patients and
Yeah.
the results, that kind of helped me out to keep that in perspective and then overcome those challenges.
Yeah.
Yeah.
You went through Columbia University,
Yes.
Cornell University, and also Harvard.
Yes.
All the best of
Did my
best.
undergrad in Columbia and then went to medical school in
Yeah.
Cornell, took some course in Harvard. So Manhattan I was that for a fellowship aspect. So we did lots of.
Yeah, not just in how to say intellectually very like excellent. You are also very courageous person. Like I said yesterday, I could never do any operation in person's eyes.
Well, from my standpoint, we get used to what we do because we're doing the same type of procedure every day. So it doesn't scare us at this point because the machines that we use are very reliable machines.
Yeah.
They're more reliable than airplanes. With an airplane, the engine can fall off or take fire or stop working.
Yeah.
With us, the machines are built very redundantly, so they never stop in the middle of a procedure.
Yeah.
Always checks and balances. It's very accurate, and we see exactly how it's happening. So there's a lot of safety built in. So we do feel very comfortable with the technology.
Yeah. Yeah. So through all these years of practicing in your passion, what's the main benefits and rewards you have already gained?
Well, I've been seeing all those patients over the years.
Yeah.
Seeing a lot of family and friends with this marvelous procedure, and seeing their next generation patients come in now, which is also very exciting.
Yeah.
You feel old at times, but I see frequently people bring their children after having it done themselves 2 decades ago.
Wonderful, generation by generation, right?
Yeah,
trust
now
you.
We're the second generation.
And you are still so young.
Thank you.
Wonderful. So for those people who are still like struggling, looking for what they love to do, and especially for those young people, right? Or people are not really enjoy what they are doing. They want to try what's my real passions. Do you have any, advice or insights to share with them?
Well, I got very lucky, I believe, in my situation because this was perfect. Once I got into ophthalmology, this laser was approved and all this high-tech stuff came up. But otherwise, you should stick to what you like, and hopefully you're going to be very good at it. And the better you get at it, you feel more comfortable with the whole process, and then whatever you're doing, you enjoy it every single day. But you have to have a passion for what you're doing.
Yeah, but behind the passion, you also have years of hard work behind it, right?
So patience involved. Yes, absolutely.
Wonderful.
Absolutely.
Thank you so much. I wish you have more and more successful stories.
Enjoy your visit.
Thank you so much. Okay, take good care. Bye-bye.